And the medical headline a lot of people are talking about right now, of course, the announcement that Pennsylvania Senator John Fetterman checked himself into Walter Reed Medical Center to receive treatment for clinical depression.
In a statement, his chief of staff said that while the senator has experienced depression throughout his life, it only became severe in recent weeks. So, Dr. Darien, break this down for us. What does it mean?
Well, depression, many of us have stories, whether it's personal or through friends, and understand this experience, as over 17 million U.S. Americans live with depression and/or are diagnosed with it. Severe depression can impede or interfere with your daily life tasks. It can lead to symptoms of sadness, irritability. Many often have social isolation, and the treatment is relative to the person's needs. Sometimes it can involve psychotherapy, certain medications, and now, again, through research, there's advanced treatments that we're coming up with today that are helping patients getting better.
Do not ignore it, right? This is not something you ignore and say, oh, I'll just get over it someday. You've got to take it on.
You've got to take it on, and you've got to check in on those that you love. Depression often, we imagine, looks like obvious sadness, but for most it does not present that way. When you find that the people that you love are retracting, they're not themselves, it's okay to ask. And I always remind people of this. It does not increase the risk of someone if you ask them if they're thinking of harming themselves. That does not increase their risk. That actually opens up a conversation that can save their life.
And when you hear of a senator actually releasing a statement and going in for treatment, does this help other people who might be having these same feelings, who maybe feel like there's a stigma still attached to it?
Absolutely. I think in that sense also, with anyone with a large platform, sharing their diagnosis creates awareness. The stigma is so real, not just in understanding your diagnosis, but even simply receiving treatment. So many have to do it in the shadows and in privacy. I think more and more need to share their stories so that we can realize that this is more of a normal experience.
Because we've been talking about functional depression a lot lately,
Yes.
and that's the one you just don't see in people. And so people really have to talk about it.
And check in on the friends and the people that you love.
That's right. And this important reminder here, if you or someone you love are experiencing suicidal, substance use, or other mental health crises, please go ahead and call or text the new 3-digit code 988. Remember that number. You will reach a trained crisis counselor for free, 24 hours a day, 7 days a week.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.